This section is all about the way Duchenne is inherited through the generations. We will also have sections on who carriers are and how the condition affects them. Genetically inherited conditions are complicated and often bring up difficult thoughts, emotions and feelings. Here at Action Duchenne, we advocate for those affected to talk to genetic counsellors where possible. We would also encourage you to always reach out and get in contact with our support team if you or someone you know could benefit from some guidance around this topic. Thank you.
So, Sophie, I was going to say that recently I came across a paper, and I was wondering if you've read this paper on cardiac care for children with dystrophinopathy and female carrying the Duchenne muscular dystrophy gene variations.
Yes, of course I have. It's a very, very good paper, and it provides a very informative information about the care arrangements for females with DMD gene mutations or manifesting carriers. So this article, I would say it's critical as female carriers, they just didn't have much attention in the past. Everyone was mostly focusing on Duchenne boys, but at some point it was like, hang on a minute, there are manifesting carriers who have some symptoms of Duchenne muscular dystrophy. That's why it's very important to focus on them and to provide therapy or treatment or care that they need.
That's true. And I think according to this article, basing it on that, care arrangements for females carrying a variant in the Duchenne muscular gene or carrying a mutation, so the care arrangements are even less well established and more variable than for boys with Duchenne muscular dystrophy. And while majority of carriers don't experience any signs or symptoms, some may develop progressive skeletal myopathy or cardiomyopathy, i.e. heart issues. So this is really an important area where the care needs should be met and there should be sort of focus on.
Yeah, and from talking to many women who are carriers, I would say that the most common complaints were the shortness of breath when they're going up the stairs, for example, or muscle cramps, or also muscle fatigue.
And I think one of the very typical signs, which is often overlooked, is also an increased calf size in female carriers. That's something that we see. Oh.
Yeah, it's a very common symptom. That's true. I've heard about that as well, that many female carriers say that they do have increased calves. But just another interesting information. So this article also introduced new terminology, or suggested to use it from now on. So they suggest using the term dystrophinopathy carrier instead of DMD carrier. So they want to accurately describe girls and women with these gene variations or gene mutations. So it also mentions that the term carrier might not be quite adequate for those with clinical signs or symptoms.
Yeah, exactly. And the article suggests that reserving the term carrier it should only be reserved for those without clinical effects, meaning no skeletal or cardiac signs or symptoms and normal creatine kinase levels. Those with signs or symptoms should be considered to have dystrophinopathy and managed similarly to the affected males.
Yeah, no, that's a very good point. They also highlight the importance of cardiac surveillance for females with DMD gene mutations. So it mentions that even in the absence of skeletal muscle manifestations, the muscle fatigue or muscle cramp symptoms, these females have an estimated lifetime risk of developing cardiomyopathy or heart issues ranging from 7.3% to 16.7% risk.
So to detect cardiomyopathy, they recommend conducting a baseline cardiac assessment using 12-lead ECG and echocardiography once carrier status is confirmed genetically. So you need to go through those tests once you've been confirmed that you're a carrier. They should follow a standard echo imaging protocol to monitor the left ventricle function and allow for serial sort of comparisons over time of the functioning of heart. So this is us just highlighting that we see it in quite a percentage, 7.3 to 16.7% of carriers. So it's really important to highlight that there is surveillance available, and if you have not been offered it, you can request it to get your sort of heart assessments done.
Yeah, so and If the female carriers have done this heart assessment and the initial assessment shows reassuring results, then it should be repeated every 3 years, of course, with the schedule modified if necessary. But that just makes sense to ensure timely detection of any possible changes in cardiac function, just to prevent any potential issues and just to protect yourself and get proper care if needed.
Yeah, and it's worth noting that females with cardiac dystrophy neuropathy rarely develop resting sinus tachycardia, which is commonly seen in boys with Duchenne muscular dystrophy during early cardiomyopathy. So therefore, medications to slow heart rates, such as beta blockers, are less often indicated initially for the females. So just because you have the symptoms doesn't mean your cardiac changes are going to be exactly the same as boys with Duchenne, but it is good to monitor these things earlier on and have like an time lapse picture as well, just so and you can manage it accordingly and provide the best care.
Yeah, and the main goal of therapy for females with cardiac dystrophy neuropathy is just to prevent the progressive loss of cardiac function. And just one more interesting piece of information that it should be emphasized, that the article mentioned that for women of childbearing age or who may become pregnant anytime soon, who are planning pregnancies, it's important to manage the drug regimen. So the cardiac drug regimen may need to be modified if they are planning pregnancies.
Yeah, and I think it's important, like with any other drug or any other treatment, to consider the specific needs of women in different stages of their life. And the article even provides additional drug and non-pharmacological options that can be considered in the management of those with advanced cardiac dystrophy neuropathy. And I think, yes, it should be personalized care. It should be looking at the stage and your health at that time and what's the best kind of medical care that would help you.
Yeah, and I think it's a very good article that provides a very comprehensive, informative, concise information. And it's so important to think about carriers as well, because they need care, they need to be checked, they need to see whether they have any potential heart issues. It's very important for their health. So that's why it's also essential for the healthcare providers to stay updated on the latest recommendations, and to know how to care for female carriers or females who have DMD gene mutations.
Absolutely. And it's crucial to provide the appropriate and personalized care, like I was saying earlier, for the population, for carriers, and consider the potential risks and variability in clinical effects as well. And I'm glad we've had a chance to discuss this really important paper, and we'll put the link up as well for anyone who wants to read further into it. But this was really good to know the facts about the care, cardiac care for Duchenne muscular dystrophy carriers.
Here at Action Duchenne, we are committed to inform, but also support you through your Duchenne journey. If you'd like to talk about anything raised in this video, please feel free to contact us on 07535 498 506, or alternatively, email us at info@actionduchenne.org. Thank you.